Good morning, everyone. I'm so happy to be here on this beautiful, beautiful spring day. And as I said earlier, we've all decided to follow appropriate CDC guidelines. And since we're outside, we're maskless. And so this is the first maskless press conference we've done since COVID. And this is not what this press conference is about, but I'll just make my commercial appeal now. If everybody gets their vaccine, then all events can be like this going forward. Everybody needs to get vaccinated, and the mayor can tell you where to go. Anyway, thank you for all joining us today so we can share our latest collective effort to help those who are experiencing homelessness in the Denver metropolitan area. Homelessness has been an issue in our community for decades, well before the pandemic hit. In fact, John Parvinsky, who's standing here, and I have been working on issues around homelessness since the 80s. You know, the pandemic didn't create this crisis, but it's really made it a lot worse. And it's made the urgency to address the issue so much greater. According to the Denver Metro Housing Initiative, in January of 2020, there were more than 4,000 people experiencing homeless in the Denver metro area, with less than 2,000 beds available. Let me say this again, 4,000 people homeless, less than 2,000 beds in this area. And that was before the pandemic hit. Millions of people out of work, millions of people are struggling to meet ends meet, and people need help, and they need it now. Every single child deserves to have a roof over his or her head when they go to bed every night. While Mayor Hancock and his team have been working very hard to address the urgent need to provide more housing, especially in this era of COVID, we've also been looking for creative ways to help with more long-term solutions that will be available to help people even after the pandemic ends. And so here's our plan. On Friday, I requested $2 million in federal funds to help jumpstart the effort to have the city purchase the Stay-In Hotel, which is here behind us, and convert it into a shelter capable of housing more than 240 residents a year. If approved, this funding will be used to help convert this 95-room hotel into 60 housing units capable of sheltering more than 200 residents a year, and 35 supportive housing units to provide mental and behavioral health services to another 40 residents a year. Studies have shown that when people experience homelessness or moved into hotels like this, they experience improvements in both their mental and physical health. They are also more likely to move into permanent housing, and they compared to people who are housed in transitional housing units. And that's why projects like this are so important. If approved, this $2 million in federal funds that we have requested will help get this project off the ground. So why now? How did we get this money? This year, for the first time in about a decade, members of the U.S. House now are able to present their own community projects for authorization by the Appropriations Committee. And this project was one of 10 community project funding requests that I submitted last week. This year, I decided that because of the urgent need for housing in the 1st Congressional District, I focused my community funding projects on funding for housing remedies, and also for helping those who were impacted deeply by the coronavirus pandemic. And my staff has a list of all of our 10 funding requests. I hope that they will all get authorized by the Appropriations Committee and passed. My homeless housing initiative also includes $10 million for Urban Peak, for shelter reconstruction for youth, and also money for the Colorado Coalition for the Homeless for housing relocation. And so those are just some of the key projects for homelessness, trying to address this urgent problem in our community. I'm going to turn it over to my wonderful friend, the mayor, in a few minutes. But I want to say, while projects like this are absolutely vital to providing shelter for people in our area, we need to continue to do a deep dive to look and see what causes this crisis in the first place. We have to identify what's putting people on the streets, and we have to work at every level of government to fix it. Earlier this year, Congress passed an emergency relief bill to help state and local governments with $21.6 billion towards assistance programs in these areas. $5 billion for emergency housing vouchers, and another $5 billion to help people experiencing homelessness. This funding is really important to address the crisis in the short term, but until we look at the long-term complex causes, we're never going to get folks in permanent housing. And we need a robust safety net to make this happen. So with that, I'm going to turn it over to Mayor Hancock to talk more about the city's plans for this site. And then I'm going to recognize Christina Carlson with Urban Peak and John Parvinsky from the Colorado Coalition of the Homeless to say a few words about their projects. Mayor?
I want to thank Congresswoman Diane DeGette. I want to thank you for your leadership and for recognizing this urgent need in Denver and for supporting our efforts to provide stability and services for our residents experiencing homelessness. Let me also recognize really the engineer of Denver's efforts around housing and homelessness in our city, the Executive Director of Housing Stability, Britta Fisher. And we want to thank Chris Carlson from Urban Peak for being here, and John Parvinsky, the guy with the long hair from the coalition, Colorado Coalition for the Homeless, for being here as well. You know, we cannot thank Congresswoman Diane DeGette enough for her tremendous leadership on this issue. She talks about all the efforts she is making with Urban Peak and Colorado Coalition for the Homeless and now the City of Denver. This is the kind of partnership we need in the City of Denver to address this issue of homelessness. I have said time and time again, at least 100 times in the last 10 years that I've been mayor, and we have been focused on this very complex challenge of homelessness, that the City of Denver cannot do this by itself. That for every person we find on our street experiencing homelessness, we must tailor the approach to help that individual. And there's no way that any city or county government alone can do this. And so to have a partnership at the federal level with Diane DeGette, Congresswoman Diane DeGette, this is huge for us and a very welcomed partnership. This building here behind us represents hope, the transformation that can take place on this property, and the transformation that is possible for the people who will call it home. That transformation is foundational to the future of our city and is a pillar for our economic recovery and its sustainability going forward. This pandemic isn't over, and it has hit some of us harder than others. As Congresswoman pointed out, our most vulnerable have absolutely been devastated by this pandemic. Many residents found themselves without jobs or the resources to sustain them through the crises. As Denver's population continues to grow, and we grew even during the pandemic, as people come to our city for support and for opportunity, the need grows for those who are most vulnerable as well. We have risen to the challenge of this pandemic by providing safer, healthier options for those experiencing homelessness. Let me share just a few of them with you. We provided funding and support for 2 safe outdoor space-sanctioned campsites. We are opening up in just a few weeks 46-bed crisis stabilization center. We're opening up a 450-bed shelter later this year. And we investing more than $10 million in recent months to create 250 apartments for people experiencing homelessness. And supporting emergency shelter services in response to COVID-19, 24-hour shelter options were available. And because of the tremendous work of Britta Fisher and her team, some 800 hotel rooms were made available to our neighbors experiencing homelessness during COVID. But we know we can, and we know we must do more. I created Department of Housing Stability with the goal of resolving homelessness in Denver. That often means preventing homelessness in the first place by providing rent and utility assistance or emergency rental and mortgage assistance. But when it isn't possible, we know what works to stabilize our residents. We know housing first works. We know for many of those experiencing homelessness, housing plus services works even better. By transforming properties like this property behind us, we can wrap our residents with services and support that will help make a sustainable difference in their lives while giving them a foundation of a place to call home. But we know it takes more than just a city to make the impact. And so that's why, again, we celebrate Congresswoman Diane DeGette bringing the federal government to bear to help us to coordinate shelters and services and providers and, of course, housing, and joining with the city of Denver and businesses to help make it happen. So we're here today to show unity and partnership and our commitment to leveraging our assets and influence and to make an impact in the form of housing for those who need it most in our city. Again, thank you, Congresswoman Diane DeGette, for your partnership. I'll turn it back over to you.
We're going to turn it directly to our...
Oh, we're going to turn to Christina Carlson, the illustrious leader of Urban Peak. Christina?
So first, I'd just like to express my gratitude to Congresswoman DeGette, to the mayor, to Britta Fisher in the Office of Housing Stability. I'm so excited to be here with them. It's just a huge honor for us. So Urban Peak is a national leader and Denver's only organization that is creates a full continuum of services for youth who are experiencing homelessness. These youth are some of our city's most vulnerable population. They've experienced significant trauma. They are often coming out of the foster care system. Did you know that 1 out of 3 youth coming out of the foster care system become homeless on the day they turn 18? They have faced generational poverty and are often part of the LGBTQ community. Most have experienced homelessness multiple times, probably first as a child. In 2022, we are so excited to break ground on a major capital project that will transform our aging shelter into a vibrant campus that includes integrative services and progressively independent levels of transitional housing. The project will not only transform that space, but it will transform our ability to deliver stabilization services, providing safe and separate shelter space for minors aged 15 to 17, and expanding our shelter access for youth up to age 24. It will triple our shelter bed capacity. Using a trauma-informed approach and design, we will bring all of our supportive services onto the same campus, along with administrative office space, transitional dorm-style living arrangements, as well as additional supportive, affordable apartments complexes. This is all with the goal of assisting youth to prepare to safely leave our programs and have independent, stable living on their own. With this project, Urban Peak will save the community an estimated $29 million a year by providing a path out of homelessness. This will allow us to serve more youth and provide more comprehensive services, not only to increasing our cost-saving impacts for our community, but supporting the most vulnerable among us. This will allow for self-sufficiency, sustainability, with the intention of avoiding chronic homelessness. With the incredible support of Congresswoman DeGette, the Mayor's Office, the Office of Housing and Stability, this project at Urban Peak will allow us to continue to serve homeless youth while becoming a national model of innovation focused on improvement, growth, and transformation. So now I get to introduce John Parvinsky, the CEO and president at Colorado Coalition for the Homeless, and he is the most fierce advocate for people experiencing homelessness.
Thanks, Christina. Well, I'm going to start with a COVID reference as well. I just left my office where our Stout Street Health Center was doing a clinic vaccinating people experiencing homelessness. We just went over 2,500 vaccines that we've given the people experiencing homelessness, which is more than 50% of the estimated folks on the street. So we're making great progress there with the help of Denver Health and the Denver Department of Public Health, as well as our shelter partners. As the Congresswoman indicated, I've been working with her probably since I started in 1985, before she was in the state legislature as a private attorney, working on the needs of people experiencing homelessness. And so we're very grateful for her support for our project, which is the Stout Street Recuperative Care Center and the adjoining Renaissance Legacy Lofts. The recuperative care program is designed to provide 75 beds for people who are homeless, who are experiencing acute medical conditions, who end up in the hospital, and if they were housed, they would be discharged to their home, but they cannot be safely discharged to the streets or the shelters without them likely entering back into the hospital system through the emergency room. And what we want to do is to avoid those bad health outcomes and the avoidable costs of emergency room and hospital visits for people who are experiencing homelessness. So with on-site nursing services and medical services and behavioral health services, we will not only be able to help those individuals recover from their acute medical condition, but then connect them to ongoing housing services so that they can get back into the long-term housing where they can maintain their health. And we'll connect them to our ongoing health services at the Stout Street Health Center, which is a primary medical care center providing integrated health, mental health, addiction treatment, pharmacy, dental, social work, and vision services. So that comprehensive piece is critical. And as we're building that, we've been able to, with the support of the city, the state, with private support through new markets tax credits, through low-income housing tax credits, be able to build 98 units of permanent housing, one-bedroom apartments on the upper floors. So it'll be a 9-story building adjacent to our Stout Street Health Center downtown. We estimate that with our commitment and our collaboration with Denver Health and the University Health Center, that we'll be able to tackle some of the highest utilizers in of the health system that is costing the Denver Health over $500 million a year, and be able to reduce that by providing safe recuperative care and safe permanent supportive housing. Now, the federal government has been providing some funding to our communities for the last 30 years through the McKinney-Vento and the Continuum of Care. But the reality is that it's only enough to keep the people previously housed with maybe 5% extra for new programming. And so while a lot of new funding has been devoted to the COVID emergency that can help in the short term, and this will help us tremendously along with the other investments talked about, but to really get a handle on homelessness and to reduce the impact of street encampments, which really does a disservice to neighbors, to businesses, and the people who are forced to live in them. We really need to double that investment, double the investment in affordable housing resources through the Section 8 Housing Choice Voucher Program, and really bring the investment back to what it was when we started before the 1980s, when most of those budget cuts occurred. So with an advocate like Congressman DeGette in working on behalf of people experiencing homelessness and those at risk, we feel optimistic. We appreciate that support, and we'll do everything we can to work with the city, work with our counterparts in terms of the emergency shelter community, and really create the housing and the long-term health and mental health services that are needed to prevent and end homelessness here in our community for good. So thank you.
Thank you so much. Questions? Right, it's for this sort of for the seed money, because for the actual cost is higher, and I think the mayor could.
And that's what I'm hoping I can get.
Yeah, sure, Mayor.
I'm not sure what the.
Yeah, okay, yeah, come on up. Identify who
And then
you are.
what the timeline would be for when that could be closed on if your request goes through. And then I was hoping to get you to elaborate just a little bit more about who would be able to stay here. You know that those types of restrictions, whether pets are allowed or couples, can prevent people from seeking shelter. So I'm not sure who would be compliant.
All right.
Hi, I'm Britta Fisher. I'm the Chief Housing Officer for the City of Denver and the Executive Director of the Department of Housing Stability. And with this acquisition at about $7.8 million, $2 million with the support of Congresswoman DeGette will really help us to not only bring more shelter now and housing in the future, but to serve people very soon. We think we can get this closed, renovated for use before the end of 2021. And so this is what is really great about using motels and hotels, is that the infrastructure is here. It really is about us coming in and getting the providers in to provide the services and help support people who have been experiencing homelessness, get them stabilized, and get them restored to housing.
And then who would be allowed to stay and who would be running it?
So we do not have the details yet on who will be running it. We have been running non-congregate shelter like this in motels and hotels across Denver for the past year. So we have several partners and nonprofits that are capable of helping us to deliver this service to Denver, but we will go through a procurement process in order to identify those partners. As far as who will be staying, it will be people who experience homelessness, but because it is non-congregate shelter where there are individual rooms, it really gives us the maximum flexibility of who we can help to serve, including people with pets and partners and their property. So it is a really nice form of shelter to get service to many others who have struggled in the congregate setting, like we've shown in COVID with chronic lung disease and who are older. Those are some of the folks who would be prioritized here in our non-congregate settings.
Thank you. Any other questions?
Yeah. Can you describe the layout and how it's going to work inside?
The layout.
Yeah, so I was asked to describe the layout. What's great is that you can see it right here. It's really external doors, motel, and there are 95 rooms. So we will be able to serve at least 94 households at any given time. We'll use one of the rooms for services as well. And then there's a community services area on the internal side as well.
There's a question right here. Yeah.
You said that $2 million in seed money was coming from the federal government funded from KUSA money, $7.8. So where's the balance?
The balance.
I was asked about the capital stack for this acquisition. We have $4.6 million in CDBG that we are putting towards this. We also have renovations to do beyond the acquisition costs. So we have asked Congresswoman to come through with $2 million from our federal partnership here. We've also applied for state dollars and other funding to help fill that gap. And so we are really looking forward to being able to say that this is a multi-governmental entity partnership that can deliver here in Denver.
So it's not going to come out of the city budget at all?
We will have the services and operating from funds like the Homelessness Resolution Fund that voters passed in the fall, which was Measure 2B. So that will help with our operating and fill any remaining gap between our other requests and what finalizes as we close.
Can you talk a little bit about transportation, getting folks to and from here?
Yeah, one of the great things about this site is that it is right near the Peoria station. So someone with an RTD pass, and there are many programs to help people connect, they can walk right to the station here. There's good bus service as we see an RTD bus pull away, and it is a convenient access for those who do have cars.
Anyone else?
Yeah.
Just maybe talk a little bit about, maybe it's too soon for you to know, but the like the referral process or the intake process.
You're the star.
I've got the details. So for referrals to shelter, we take those through a central, people can access shelter at many doors, but we help to get people to our non-congregate shelter through a call-in number where we help to prioritize people based on some of the conditions. Because right now our non-congregate shelters are FEMA funded. And so there are certain constraints, and that means people who are over the age of 65 or who have underlying health conditions that put them at great risk to COVID-19 and negative outcomes are prioritized within our current system. As the pandemic lessens, we will continue to have people that have those kinds of health needs, but we will also then have more flexibility as we move forward in who we can serve with our non-congregate shelter.
I think we have time for one more question.
One more
Yeah.
question. Yeah, so maybe it's for John. Is this this the first time that the city of Denver has ever purchased a motel for this purpose? No?
I'm gonna let you talk.
You know, the city has. I think it's the first hotel purchase that they've done. We've done a couple ourselves, and we've done some leases of 6 motels that we've been using for COVID. But 2 years ago, we converted a property at 37th in Quebec for 139 rooms, and it's been a tremendous benefit, bringing housing online quickly and being able to provide the on-site services. The city has, though, provided significant funding over the years to support the development of permanent supportive housing, affordable housing, the investment in 24/7 shelter, quality shelter, which is so critical over the last couple of years, and with the 2B homeless resolution funds that the voters passed last November, more and more investment is coming. So the city is probably, in the 35 years I've been doing this, we've never had a better city partnership in terms of dealing with homelessness. Now you may wonder, why do we see so many people on the streets? Well, there's too many feeders into that system. So these folks are working as hard, and we're working as hard as we possibly can to address that. But it just shows that we need to do more, and through the efforts of the Congresswoman, this helps us to do more.
But as far as you remember, in 35 years, this is the first time the city has purchased.
Yes, the city has purchased shelters, and I don't want to speak for the city. The city has purchased buildings to be used for shelter, but I'm not aware of a hotel.
Let me add on to that, because I think over time, people like John and the city and others recognized that just doing temporary housing for the homeless was not a permanent solution, and it wasn't a permanent solution for many groups of people. And so, and you heard these folks talking about some of them, people who are older, families, others, just cycling them in and out of transitional housing. That works for one purpose, but not for all purposes. And so that's why, if somebody has a pet, or if they have a partner, or if they have if they have some kind of a condition that restrictions on some of the transitional housing have, then they have no alternative but to go to the streets. And so a few years ago, a number of the homeless advocacy groups around the country started to realize that empty hotels and motels like this are really perfect for giving people stable, permanent housing, and being able to then place services like the ones that the Coalition for the Homeless provides, right there, and also Urban Peak provides these homeless these conditions for youths. And so what they've realized is, to give people a stable place to live and to be able to access the job training, the drug counseling, whatever they need, that gives them a much better hope of then being able to move on to other housing. So this is now the new this is sort of now the new trend for cities. Is cities now are beginning, the trend of course was started by the advocates, but now cities across the country are looking at some of these unused properties and saying, this is the perfect way for us to get people off the streets, out of the Civic Center Park, and into a place that's more humane for them, that helps them get their lives on track for permanent housing, and is also better for all of the citizens who are in that area of the city. So I think it's a win-win-win. I'm passionate about it. That's why I decided to make to make these really important brick and mortar projects part of the core of my member-directed spending this year, because this is what's going to really help us to solve the problem in the long run. So thank you everybody for coming. Have a beautiful weekend, and thanks to all my wonderful partners here for the years of work that they've done. Years of work.
Thank you.
We saw your letter, Nicholas.
I told my staff. I told my staff that when I first found out about it. Tell him that because John knows. He worked with me when I did that Dorothy King case. That's what he's talking about. Is when I was a lawyer, I had this client who was a homeless activist for families, and she and her buddies went and broke into a HUD house.
All right. So this is as far as you remember,